Thank you for being here. We appreciate your attendance for this wonderful event. Just a reminder, it echoes pretty good in here, so if we can keep it a little on the quieter side while our speakers are going. We have a full program, and without further ado, I'm going to turn it over to Supervisor Otto Lee.
Good morning, buenos dias, 早上. I'm saying so many languages here because of the fact that we are a diverse Santa Clara County. Good morning, everybody. My name is Otto Lee. I'm honored to serve as your county supervisor, representing right here in Berryessa, Milpitas, Sunnyvale, and Alviso area. And it's truly exciting right here today in San Jose because we're here for the gathering for this important ribbon cutting for our brand new Valley Health Center in Lundy Clinic. Huge round of applause. Look around this place. Isn't this amazing? How pretty and how amazing this is. This really is a lot of work. It certainly takes a lot of work of love to open one of these facilities. And I certainly want to recognize so many people. And I know I'll miss a few people, but at least I'll try to thank some of the partners that certainly made this possible. First of all, of course, Paul Lorenz. Greg Price. I saw Greg earlier. And Sonia Menzies, and their team from the Santa Clara Valley Healthcare. Let's give that a round of applause. Of course, to build anything in the county, we need our facilities and fleet, TSS, security, infection prevention, and the quality and education departments as well, supply management, and environmental services. And give them a round of applause as well. All the internal partners includes laboratory, diagnostic imaging, pharmacy departments. Let's give them a round of applause. And finally, but not least, of course, is the external vendors and partners who put all this together, including ACOM, SBAY, TMI, RFI, Comtel, Bastion Security, Brightview, and Halista. Let's give all of them a huge round of applause. And then, of course, we cannot forget the most important ones, the ones who have worked in our TB and refugee clinic all these times and how much it would take them to get this thing staffed up. And you can see how everything is getting ready. So let's give those guys a real round. So this new clinic has a very special focus on our community, especially for our TB, the tuberculosis, and our refugee clinic. The County of Santa Clara has made a priority to welcome and support refugees from all around the world. We, of course, experienced those from Vietnam after the fall of Saigon in the 1970s. We've experienced recently Afghanistan and also Central America as well. Some of you may be familiar with my personal story. My family's journey to America is ways mirrored some of the experience of refugee. And we fled political upheaval when I was in Hong Kong, when Communist China taking over. Our family says, we're out of here. And I know how it feels to suddenly find yourself rushing to a new world, having to start all over again. Learning a new language. English is my second language. That's why I can hear my accent. But more importantly, really, is to make new friends and get to an environment that you're not familiar with, especially a lot of the younger children. And just this last year, I certainly have a close connection to refugee experience when I get a chance to visit Poland to see some of the Ukrainian refugees leaving Ukraine to escape from this illegal invasion from Russia. These issues are very real. When they say think globally, act locally, this is exactly what we are doing to help so many of the individuals who are suffering from the traumas, from the wars, from all the fighting that's going on. And you know, what I think is really important is that providing care for refugees is so important and personal for me. And especially if so many kids are impacted as we see every day. And while it makes it feel like we can't always do everything, right, because the world seems to be in crisis so much, we certainly can, and this clinic will have the chance to help. As a transition from one life to another is already hard enough, getting in medical and healthcare should not be that hard, right? Because after all, 1 in 40 residents in our county is a refugee or directly connected to refugee families. Expanding this care is living up to our county's mission to care for the whole of our community. And in addition, The airborne isolation facility right here will also provide services focused on tuberculosis with a pharmacy, a lab, x-rays, culturally competent care to provide care to minority communities and also non-English speaking families, which of course we have so many. As we know, more than half our families here actually don't speak English at home. Isn't that amazing? And this clinic will be a major overhaul boost to the community. Healthy individuals make a healthy community, and that the County of Santa Clara, everybody gets good care. Our Santa Clara Valley Healthcare and our County of Santa Clara are looking out for everyone, and we are of course doing our best to close the gaps we have. We are bringing care to our neighborhoods. The clinic's location right here, closer to families in need of help, and we're creating another win-win scenario for everyone. The American dream has started in so many neighborhoods across the South Bay because we have cradled opportunities for people to dream and to thrive, being mindful about how we lend a helping hand to those most vulnerable and what it takes to make the American dream real and vibrant. Refugees will find respite in our county to dream once more. I encourage our community, particularly our refugees and newcomers, to come in here for care and know that you will be welcome upon your arrival and walk out knowing that you, your family, will have the county behind your back, that you can count on us, right? Yes. Today, we have many wonderful speakers, including Abdul Nouri, a refugee coming from Afghanistan, and their stories. And their stories and the work of the drivers of why we're opening this clinic. And we also have Tram, I just saw you right there in green, beautiful. There's also a refugee from Vietnam here 30 years ago with her dad. And guess what? She's now working for the county, right here. Well, first of all, thank you very much for being with us today. I'm really excited about this ribbon cutting. And then I'll go ahead and introduce our Chief Operating Officer, the awesome Greta Henson, right here.
Thank you so much, Supervisor Lee. Well, I will just add to the many wonderful thank yous you just heard with a beginning by thanking Supervisor Lee and the members of our Board of Supervisors who have been such fantastic champions of our entire health and hospital system, of all the work that happens in every clinic, in every hospital across our systems of care. And so just thank you for your leadership, Supervisor.
You guys who do the hard work to make me look good, so thank you.
Well, we'll keep doing it. But speaking of that hard work, I just wanted to take a couple minutes to just say thank you so much to every member of the county team who contributed to the creation of this clinic and who will do the exceptional work of welcoming new members of our community who come from around the world and need a warm, open-armed welcome and the care that is absolutely necessary and unavailable in so many parts of the world from which people come to this county. And our health system is one of the first opportunities for folks to really understand the breadth of services that the county offers. And one of the hallmarks of our specific identity as a county organization is the beautiful, diverse community that we serve and our specific and long-standing commitment to welcoming immigrants regardless of immigration status, regardless of any of the circumstances that have brought them to our community, and to offering them the most extraordinary care. So I just want to say thank you to all of you who will work in this clinic, who work in other parts of our system of care, and who contribute every day to showing the community what excellence in service to the public looks like. And it is so beautifully embodied here today. So thank you so much. And with that, I will turn it over to Sonia Menzies, and she will also share more about the incredible work that will happen here.
Good morning, and thank you so much for joining us. Thank you so much to Supervisor Lee and to our wonderful Board of Supervisors who are so exceptional in really supporting our community health services here. Also to Greta and the team and county leadership and our healthcare leadership team led by my boss, Paul Lorenz. So just to let you know that this beautiful new clinic couldn't have happened without so many people working together and really involved in enhancing the services that we can provide. We have a significant number of patients in our community in California as a whole and in Santa Clara County with tuberculosis who rely on us, our providers and our teams for care. And this new wonderful state-of-the-art facility is going to be able to further enhance our ability to take care of those patients successfully in a really safe and nurturing environment. The Refugee Health Assessment Program provides for healthcare services for many folks who arrive here, refugees, asylees, humanitarian parolees, special immigrant visa holders, and victims of human trafficking. Many of them have faced terrible and significant events prior to arriving with us, obstacles and traumas that we can't even imagine for many of us. So it's so incredibly important that we're able to open our arms and really embrace them in this care that we're able to provide in this facility. This new clinic will be inclusive and welcoming as a point of entry for all of those folks. We've got adults and children in great need of our care. With the new arrivals, we're able to screen in this building for many communicable diseases. We're able to screen for multiple health issues and behavioural health needs that they have, and many of them, this will be the first experience of such a comprehensive healthcare system. So it's, again, incredibly important that we really nurture and provide that care. Additionally, apart from the clinical services, we provide for social workers, for mental health assessment, for financial counselling, all of the things that can make a successful transition occur. Patients will be able to be referred to our adult and paediatric primary care services and into our specialty team areas as well. They're able to receive essential vaccinations that are required, getting children to school and parents out into the workforce successfully. I really want to thank our many county partners, including the public health team who work closely with us. Pharmacy is a very large element of what we do here, so thank you to our pharmacy team for the extraordinary work. And I especially want to call out great thanks to our fleet and facilities team who have really helped us to establish what was a dream for a clinic for us into this beautiful reality that we have for our patients now. The clinical team are led by our health centre manager, Nelda David, and the team has put their heart and soul into the development of this clinic space that will really nurture the patients who come in to be cared for. And with that, I'd like to hand over to Nelda to say a few words. Thank you.
Hello, everyone. Good morning.
Good morning.
I am so actually filled with emotion today because it's been a long few years of trying to get this building open, and I am so honored and so happy to see all of you here that I've worked with for so many years and are here to come and see this facility that we've all worked hard for. I am so honored to see old colleagues as well, Dr. Poleski right here, our medical director from years past. I would like to thank you, and I'm honored with your presence, Supervisor Lee, Greta, Sonia, Paul, and of course Mr. Nuri and Tram. Thank you so much, and thank you all for coming over, giving a little bit of your time to learn about this facility. Appreciate it, and celebrate with us actually after the tours. So I totally forgot to introduce myself. My name is Nelda David. I am the health center manager for the TB and refugee clinics, as well as the PACE HIV and infectious disease clinics over at Moore Park. It is my pleasure to welcome you here today to Valley Health Center Lundy, which will house the tuberculosis clinic and the refugee health assessment program, two very vital programs in our county's health system. This 20,000 square foot facility is a fully equipped airborne isolation facility designed to keep our patients and staff safe by preventing transmission of airborne transmissible diseases such as tuberculosis. We now have an HVAC system that supports the proper airflow and the disinfection of infectious particles in the air throughout the facility. this is an especially important feature of this building, as the Santa Clara Valley Healthcare TB Clinic treats about 60% of the active TB cases in Santa Clara County, a county with the third highest incidence of TB cases in the state. We also offer one of the largest latent TB programs in the county so that our community can readily access medical treatment to prevent active TB disease. Latent TB is what most people would call sleeping TB, which is non-infectious but predisposes you to a risk of developing active disease later on. So preventative treatment is very important. As of 2020, the CDPH estimated that we have a very large reservoir of latent TB infections in the county of about 170,000 individuals in the county of Santa Clara. So this program is really very important for us to really expand and make available throughout the county health centers. And just like our current location, we will offer a one-stop shop suite of services, which will include financial counseling for healthcare coverage, laboratory and radiology services, and a full-service pharmacy. And all of these services can be accessed by all of our patients in Santa Clara Valley Healthcare as well. We hope to serve about 100 patients a day in this facility, and we have room to grow. So we have a lot more exam rooms and a bigger space, and we look forward to welcoming more of our patients in this facility. I am so incredibly excited to have not only all these services, but a nice and open space. For those of you who know, the TB and Refugee Clinic was for a long time, for about 2-3 decades, in the basement of the Lenzen Public Health Alameda building. So we didn't have windows and we didn't have natural light. And so we purposefully designed this building to have all natural light come in and bring the outside in and bring nature in. I am a lover of nature, and that is pretty evident in what you see on the walls. And it is really, really a nice place to welcome our newly arrived immigrants and refugees. We have been welcoming refugees, asylees, special immigrant visa holders, victims of trafficking, now humanitarian parolees, for the last 3 decades. And we hope to continue to do so in this brand new facility that also provides a welcoming and safe place for our patients. All of these families, it's very important because all of these families and individuals are starting to rebuild their lives and join the larger community. And we know that it can't be easy to travel so far, to uproot your families, and to bring them here to try to rebuild and start a new life. So it's really important for us to provide all those resources, help them navigate the healthcare system, help provide the basic healthcare needs that sets them up to be successful and integrate and live and rebuild their lives in their new communities and in our county. We, aside from providing basic healthcare needs, also provide and connect them to primary care providers and resources for food, housing, transportation, and many others. This past year alone, we welcomed and provided care for almost 800 SIVs, or special immigrant visa holders, and humanitarian parolees from Afghanistan and Ukraine. And as you can imagine, I said this earlier, it can be one of the most traumatic experiences one can have. As such, we're grateful for the continued partnership with AUKI, Centers for Survivors of Torture, for providing mental health support services for our patients. I already said this before, but I'm going to say it again. I'd like to thank you for your support because this is really a great testament to our vision and mission of building healthier communities and providing equitable healthcare access for all. So thank you very much. Finally, and most importantly, my deepest appreciation goes out to our healthcare team and every single person who provides direct care, compassionate, respectful, excellent, and amazing care to all our patients. And to the teams behind the scenes who help make that happen, thank you so much. And finally, without further ado, I would like to introduce to you Tram Pham. She is our registered nurse. Please come up, Tram Pham. She came into the country in 1993. In 2013, she joined us at the TB and Refugee Clinic as a registered nurse. And it is her 10th year anniversary this year in the TB and Refugee Clinic. And I will allow her to share her story. Please, Tram, thank you so much.
Hello. Good morning, everyone.
Good morning.
The first thing, my name is Tram Pham. I'm one of the tiny nurses in TB Refugee Clinic. First thing I would like to say, dream come true. My family came in the United States in 1993, and then I was one of the patients in refugee clinic. And I can't believe that I received the best care in the world to prevent tuberculosis. That's why I can go through the nursing school and imagine that one day I end up in TB clinic as the nurse and see myself 30 years ago. Sorry. I learned a lot from 3 director, doctor in TB clinic, starting with Dr. Bhatia, Dr. Poleski, and now with Dr. Sami. I really appreciate that all my staff now working so hard at Lansing. They cannot participate the open house today just because the patient care. We're still opening the clinic today to care for patients. I can see the transition from the patient in refugee clinic coming to the nurse at Lansing. We only have 3 exam rooms. Stay in the basement, like Nelda said. Window very simple, but we don't see window every day. And then, if the negative air system shut down, we have to send the patient home. Really sad. But right now, with the new system, we have 14 exam rooms. Every room have the negative air exchange individually. If technical problem, we just shut down only one room. That's really appreciate everybody work really hard for patient. And now we can provide all the care. We can see the sunshine. Everybody happy, staff happy, and also the patient very happy. And I'm really proud to be a team in Lansing Refugee Clinic, that we work as a family. We very lucky have very excellent management. Now that just upper level Sonia support us, listen to us, how many years that we would like to move, but finally dream come true. And then the last message I would like to send to everyone that TB is curable, and we here to help every single patient, no matter what, where you coming from, what language do you speak. We do our best to help patients to prevent tuberculosis, to help if you have tuberculosis, and if We welcome on refugee immigration. We do our best as we can. Thank you, everyone.
And we have one more speaker. We are going to welcome up Abdul right now. Abdul, would you like to come up and tell your story?
Hello and good morning, everyone.
Good morning.
And I am happy to be here between you, great people. Sorry for my English, first of all. And my name is Fatah Nouri. I came from Afghanistan with my family. We just came 2 months before, and we were lucky to receive the services from the refugee clinic, especially for our medical treatments and services. So I was looking for this time to say thank to everybody involved in this clinic, and best wishes for them for their great work they're doing. And I was very lucky to receive the services from them. And when the immigrant or refugee comes from different society, from diverse culture, they will definitely have problems, especially in language or culture. But the refugee clinic helped us to resolve this problem when we visit their clinic, and they are like a bridge between the refugee and the services providing. So I congratulate this building, and best wishes for their next works, and looking forward to be with them as a patient and as a refugee. I look forward to receive more benefits from them as they give us till now. And I'm a little nervous, sorry for my language. I'm happy to be in part of you and between you all guys, great people here. And thank you all of you for the whole services. You're doing a great job.
Thank you.
Incredible job. Thank you to all of our speakers.